right? So if there's anything, you are welcome to WhatsApp me. You are welcome to email me. All right. So this is my email, and I think most of you have already known my contact number. All right. So as an introduction, I think because you guys did not go through your what do we call that, the LI, your practical in UVH. So but I think most of you would be aware of who are the consultants, who are the VOs, and all the staffs in the large animal ward. So I'm just going to introduce to you. Okay, so these are all the ruminant unit consultants. We have Dr. Siti, the Siti Zubaida, and then we have Dr. Shah, Dr. Sharifah Sama, and then we have Prof. Jessie and myself. All right. So these are all the consultants. So hopefully you guys will be seeing us. And we also have VOs, our veterinary officers. So please get to know them as well. We have Dr. Shahira, we have Dr. Shima, we have Dr. Wan, we have Dr. Azim, and our the newest VO is Dr. Lokman. So currently Dr. Shahira is on a study leave. Okay. So you might not be seeing her much. I think, yeah, I mean, you are not seeing her for this semester, Dr. Shahira. All right. So, but for the VOs, they are I mean, I'm just include all other units. So just, you will bump into them in the large animal wards. But the one that who is going to rotate in ruminant rotation will be Dr. Wan, Dr. Azim, and also Dr. Lokman. Okay. And these are all our AVOs. For the ruminant unit, we have Encik Nazim, and then the other AVO that are around in the large animal ward is Miss Bian, okay, Cik Tuan Nur Mahira, and also we have Cik Aizul. But Cik Bian, you might be seeing her in surgery, because she's involved in the surgery, and then Cik Aizul is actually more into the exotic in avian practice. And we have all these VAs. You might bump into them in the large animal wards. We have Puan Mazwin, we have Encik Azri, we have Cik Fitri, and we have Cik Iman. Okay, and also we do have a general assistance. Okay, Dr. We have Cik Magis. So this is Cik Magis. You will be signing your attendance in the ambulatory, so which will be handled by Cik Magis. And other GE that we have is Cik Adam and also Cik Afandi. Okay. Right. As part of the assessment, you will be assessed based on your psychomotor, of course, because this is hands-on clinical skills. And I'll be showing you guys later on the rubrics. Although you might not understand what are all this psychomotor knowledge and everything, but this is just to let you know what are the things that you are going to be assessed for. Okay, of course, psychomotor, your motor skills, your hands-on skills, which involve the clinical skills and also the communication skills. Okay, and then knowledge, everything that you have learned from the for the previous 3 years during your preclinical years will be applied during your rotation. So that will involve 20%. And of course, your leadership skills, which involve your professionalism, your attitude, your teamwork, ethics, etc. So all of this would also consist in the assessment, which carries around 10%. All right. And other than that, I think you might know that you're also being assessed as a whole. In the whole course, you are going to be assessed through pop quizzes. What else? Yeah. All those quizzes during rounds. So pay attention to rounds. You are required to attend all rounds. Okay, so this is just, I think, I'm not really sure if we have gone through this. This is actually part of the induction for the large animal ward. So just let you know, because you guys did not go through your LI in the UVH. So these are the dress code. Of course, when you're going to the farm, when you're going to the farm fresh, TPO, etc. In ruminant, because you involve in the large animal practice, ruminant equine. So you are required to wear this one here, green coverall, okay, and also gum boots. However, when you have like awarded cases and everything, so you are allowed to wear lab coat, okay, sometimes, but always wear coverall, clean coveralls. So let's say that in the morning you are required to go to the farm, and then suddenly when you go when you come back to the UVH, and then suddenly you have a new case coming, uh, then it is best if you can actually change your coveralls. If you don't have coveralls, so you have to wear uh, lab coats. So this is part of the biosecurity. Okay, or if there's another case in another farm, so you are not allowed to wear the same coveralls. Okay, attending the case in the next farm. Okay, so make sure that your coveralls are uh, clean. Okay, and please wear safety boots uh, when working with animals, with large animals. All right, so safety is very important. All right, safety is very important when you're working with, when you're dealing with, what do we call that? When you're dealing with large animals. Okay, so if you have, now we are talking about handling animals in the large animal ward. Okay, but it applies the same if you are handling cases outside. And of course, when you're going outside, you'll be going out with a clinician, and hopefully there will be VA or even AVO around. So when you're working in the large animal ward, if you're dealing with large animal, large ruminants like cattle, so at least 2% will be handling the cattle. Okay, you are not allowed to do this on your own. So you have to get a staff uh, to help you in getting out a cattle into a crush. Okay, and you are also not allowed to go inside the cattle pen by yourselves, because it's very dangerous. However, you can actually have another buddy, have another someone, if you're dealing with, if you have cases among small ruminants like sheep and goats. So that is allowed. Okay, but make sure, so this is when you have to apply everything that you have learned, restraining, etc., during your rotation. All right, so this is just a picture showing like this is how why you should be wearing your coveralls. Okay, because everything here like um, this is just to show you that we have, I think this is a calf, okay, giving IV subcut fluids or injections, some yeah, in the legitimate ward. So this is just a picture of what do we call that? This is actually in the exotic ward, okay, but you, this is not, this doesn't apply in the ruminant unit. Okay, so so after you after the cattle is being taken from the pen, so if there's something that you would like to do, if you're going to do examination, you're going to do PE, you're going to give medication or whatsoever, so make sure that the animal is restrained in the chute. Okay, so this is called as a crush or a chute. uh, and always work under staff supervision. That is very, very important. Okay, so this is just to show you what are the forms that we have in the ambulatory, in the large animal ward. Okay, because sometimes you might receive cases from outside and everything. So these are all the forms. You are not required to actually like fill in by yourself and do everything on your own. This is just to introduce to you that there are forms for you to I mean for your knowledge. Okay, so whenever the client comes in, bring in the animal, and then if you're going to ward the animal, so this is the form, the client arrival form. Okay, so that they have to sign here, fill in all the details from the client, and then they have to sign. And then this is actually, this is very important, patient medical record. uh, we have a different PMR form. So for the small animal practice, it's a different one. For the large animal practice, it's a different one. And I think for the swine practice, it's also a different one. This can be found, this form can be found in the ambulatory. Okay, so we have inside the ambulatory, we have a different slot for different forms. Okay, so you please get familiarized with this form, because while doing your PE or jotting down your asking history, asking the client's detail, all the findings from your PE and everything will be written down using this form. All right. And then this is just an estimate of charges, because sometimes there's a requirement for the client to pay for the deposit, something like that. So this is to be filled by the clinician, not you guys, okay, because you do not know what would be the estimate for all the charges and everything. And then just so you know that we also receive cases and we go out to farm ladang angkat. So for the ladang angkat cases, the fee would be 100% because I mean we will get 100% discount. So but all the process of filling in forms are the same. It's just that towards the end, they get like 100% discount. So just to let you know, because most of the during the rotation there will be majority of the cases will be coming from the ladang angkat. Okay, so this is the forms that you guys will be using if there's any awarded cases. So this is called DPN. So I think this is just the same in the small animal practice daily progress notes, in which that you have to update the case daily. So it's very important if you perform a physical examination daily, and then any updates will be written down here. Okay, we do have a VetStar system, but currently it is under we are renewing the license. So perhaps by next year we should be able to do this. But this one here is not under this is not your under your jurisdiction. So this is actually the clinician themselves who needs to update key in all the cases using the VetStar system. But otherwise, this is all manual, involve hard copies, and you just have to write down. Okay, and then of course TPF, the treatment plan form. So everything that is being given, any medication and everything. So this is where you should update. You have to include the name of the drugs, the dosage, the volume to be given, the route of administration, etc. For how long, the frequency, etc. So everything is to be written using the TPF. Okay, and we also have like this IV therapy form. So if the patient is required to be administered the IV fluid or even subcutaneous fluid or any kind of fluids, so this is the form that you should be using. Okay, so what kind of so you have to calculate the amount of the fluid to be given, what kind of the fluid to be given, etc. So this is the form. This is the we call this as like the borang kuning yellow form, the summary of expenses. So this applies to every single cases that you have handled, even if you're going out to the farm and then you come back and then you are required to like jot down each and every single consumables, drugs. If you use like 5 mil of antibiotic A, for example, so you have to write down there. But there's another column, I think this one here, okay, unit price. So uh, you don't have to fill in anything because this is under the hospital. So if you can actually write down every single thing that you have used, okay, the drugs, the consumables, for example, like you use perhaps like one roll of bandage, for example. So you have to write down here. Okay, so at the end, the staff will be able to come up with the estimate of charges for each of the case. Yeah, for each of the case. All right. So this is just so you know, okay. Whenever you are dealing with a medication for the warded cases, so the drugs will be coming from the drug box or the cabinet. Okay. So we have our own pharmacy. It's just beside the ambulatory. Okay. Or even some of the drugs will be kept in the fridge. So always double check on the treatment before it is being given. This is under not under supervision, but the amount and everything is actually under the clinician's approval. Okay, so they have to write down and everything. So just make sure that if, for example, drug A is required to be given 5 mil, so make sure that you give 5 mil. Always check on the route of administration. So do not give IM drugs IV. Okay, so because that happens, so you have always to double check on that. Okay, so drug preparation to be supervised by the staff and also by the treatment. You are allowed to do the treatment on your own, but make sure that there's staff around to supervise you guys. All right, so this is just to show you another forms, patient discharge form. This is when the patient is being discharged after being warded. Okay, there's another form called the preventive medicine summary sheet. we just call this form as HHP. So this form is being used for any herd health program. So if you are going to collect feces, for example, in a number of animals for simple flotation method, for example, so you see that this is actually another form. So I've actually uploaded the form in the Padlet for you to use later on. And if you're doing deworming, if you're doing vaccination, etc. So anything that is actually herd health program. So there's another form for you to fill in. It's just that I don't actually include this in this slide. This is just to show you like a large animal surgery unit, which sometimes you might be having surgical cases during your routine rotation. Okay. So if you're doing any GA, so this is being done in the induction room or in the recovery room. Hospital tak payah. So please wear scrub suits. So if you have any surgery, change into your scrub suit, meaning that you would need to prepare your scrub suit all the time. Okay. So this is just to show you the area. This is the induction room, and then here is the recovery room. Although this is mentioned for horse, but sometimes we do put cattle inside here. Okay, so this is just to show you the large animal surgery, the OT, the scrub room. Okay, and this is the dress code if you have a surgery. So induction room in the recovery room, so you would need to wear your lab coat, but inside the OT or the scrub room, you have to remove your lab coat. All right, so done here. I'll just have to show you my rubrics. So if you guys have any questions, so feel free to ask me. Okay. All right. So this one here, you don't have to. Can you actually see my rubrics? I hope you can see. Okay. So this is what you're being assessed for. Okay. You don't have to worry about this one here because this will be made online, available online. I will do it and I will pass it to the clinician in charge. Okay, but perhaps I might need help from the group leader, just to make sure that just to remind your clinician to fill in for these rubrics. Okay, so have a look. I'm not going to go one by one, but this will be uploaded in Putra Plus later. So please be aware of what are the things that you're being assessed for. Okay, like I've mentioned before, psychomotor, knowledge, and leadership here. All right. Okay. And then so when you have you're going to start your rotation. Okay. um every Thursday you need to sign in your attendance at Miss Vargas. Okay, if you cannot come or anything happen, you can always WhatsApp me at this number or email me. Email might be like a bit slow response, but I would prefer you just to contact me through WhatsApp. Yeah, and we need, of course, if you are not, if you're sick, of course, we do need your MC, or if you have any emergency, family emergency, so maybe perhaps you can just what do we call that? Just forward the death certificate of close my family members to me. Okay, and sign in by 9 a.m. because you do have rounds, you have to attend rounds. So, but please make your way quickly to the large animal ward uh, as soon as you can, okay, by 9 a.m. So basically, we will divide into two groups, okay? Of course, you have two groups, but always combine. So one group will be going to the farm fresh, whereby there will be like a HHP program, and another group will be going to the farm or for some revisit cases. Okay, so this is just like so far the summary of what is happening every Thursday for the ruminant rotation. So this one here, just highlight, but it is not finalized yet. It's okay, right? Individual rota marks will be by online. Okay, I've mentioned before. And also please upload your because whenever you've come back from your HHP or even cases, so please use your PMR form and also the HHP form. Upload together with the pictures being taken during your rotation in this Padlet. Okay, this is for you to upload everything. Right. This is just like must have, like every time you go out, even in the ward. So please don't forget to bring everything here. Okay, so it's very important. Attire, as I mentioned before, clean coveralls. So if you can actually have another set of coveralls, just in case if you need to go to another farm. So it's always good idea to bring another set of clean coveralls. Name tags, please make sure that you wear your name tags. Footwear would be gumboots, as mentioned before, but don't wear your dirty gumboots inside the van, inside the van. Please change it to your shoes. No sandal, but it has to be covered shoes. Jeans, you can wear jeans, you can wear round collar t-shirts if you are handling any weekend cases. And if you don't comply with everything here, you may be asked to leave. Okay, so failures, running out of time. So actually this one here is, you can just read through, okay, what would happen. And of course, if you fail during your rotation, of course you have to, what we call that, you have to uh, ganti lah. Okay, you have to repeat your rotation. Any question so far? So I will upload this. I haven't uploaded any of the instructions in the Putra Plus, so I will do it later. Do you guys have any question? If none, you can always contact me. You can always WhatsApp me whatsoever. Okay, please read. I know that today's will be like too much of information, but if you're starting your rotation, for example, next week, so have a read at all the instructions. So this applies to all other units as well, okay? Because you forgot. I don't ask you to remember every single thing that I've mentioned here, but a, a day before, perhaps on Sunday, so please have a read on the instructions for each of the units so that you don't actually get confused on anything. All right. So if there's none, I thank you. All right. See you guys later. Have a good rotation this semester. Thank you guys.
Thank you, Doctor.
Thank you, Rota.
Thank you, Doctor.
Hello, Assalamualaikum and good morning. Okay, today I'm going to share with you the instruction and also the assessment for parasitology rotation. Okay, so the documents are already uploaded in the on the Putra Plus. Okay, there's a two document. One is basically is the instruction, and the second one is the assessment. Okay, so I'm going to share with you the document now. Okay, so okay, we go to the first one, the instruction. Okay, here for the parasitology rotation, it will be started at 9 o'clock. Okay, please be sharp. Okay, can you see the instruction? Okay, good. So okay, okay, the venue will be in parasitology lab. Okay, and the most important for your attire. Okay, please wear a clean lab coat. Okay, make sure you have a lab coat because it is in the lab, right? So make sure you wear a lab coat all the time. Okay. And then you should have a covered shoes and also wearing face mask. Okay, that's to follow the SOP. Okay, I would like to highlight about the attendance. Okay, one attendance person in charge will be Puan Masato. Okay, you know Puan Masato, right? Because before this, you see Puan Masato before? If not, you don't know it, then you can Google. Okay, it is available on our website. Okay, the attendance is compulsory like other rotation. Okay, so any problem related to attendance or you cannot come because of you're not healthy or any reason, please contact me. Okay, you can contact me either through WhatsApp or you can email me earlier. Okay, maybe 3 days earlier, not in the last minute. Okay. And then okay, that one for the attendance. And for your attire, as I mentioned, you should wear the lab coat and shoes. It should be covered one. Okay, no slippers, no sandals. Okay, and then if you have long hair, it should be tightened properly. Okay, so that's for your attire. Very clear? Hmm? Okay.
Yes, Doctor.
Okay, good. And then for the flow of rotation, okay. First when you come, okay, 9 o'clock. What you're going to do is you see Puan Masato and then sign for your attendance, and then it will be followed by you're going to do fecal and blood processing. Okay, so there will be several techniques you're going to do. Okay, um and then it will be after you did the process, and then you're going to have discussion with the parasitologist on duty. Okay, so please, okay, before maybe 3 days earlier before your rotation, you contact the lecturer in charge. Okay, in order to arrange the discussion. Okay, so please group leader contact the lecturer in charge 3 days before the discussion. Yeah. Okay, and then about the rubric, your assessment, okay, you should print out before you come to rotation. And then what you're going to do is you're going to pass that rubric paper or the assessment paper to parasitologist, okay, in order to for us to give marks. Okay, we're going to evaluate you based on several components that I'm going to tell you later. So please bring the rubric mark together, okay? And then as usual, when you're working at the lab, after you finish your work, okay, please make sure your work area is clean and dry, okay? Okay, I think yes, this is my phone number here. Anything emergency thing, you can call me directly. Okay. If not so emergency, you can WhatsApp. Okay, that for the instruction, and then for the assessment. Okay, as you can see. Okay, there's a 4 components for your for the evaluation. Okay, one regarding your knowledge. Okay, knowledge, information. Okay, and then the most important for our lab rotation, I think you are able to perform the diagnostic method that we teach you last time. Okay, so for example, like your simple flotation, your McMaster slide, your McMaster quotation. Okay, so I hope that after your rotation, you are able to do like McMaster your own, and then you are able to interpret. Okay, because you remember for your math master, you got calculation. Yeah, you got a formula of EPG, OPG. So after that, you know how to interpret it. Okay. So please remember how to do it and also how to apply it. Yeah. And then third component, we also going to evaluate you in terms of communication skills. Okay, so please, when we evaluate you, try to try to talk and also I think this one very easy one, right? But make sure the explanation is clear, okay, and well understood. And then professionalism is so it is so important, okay, in the lab. Please be punctual, you need to wear appropriate attire, okay, and then you are ready for the discussion and you are able to do the lab procedure, okay, and you also showed spirit of teamwork, okay. So that's the briefing, okay, for the parasitology rotation. So I hope it is clear for you guys. Do you have any questions for this rotation? If none, then I think that's all from me. Okay. Ada tak soalan? Or you can okay, you can contact me, okay, if you are not so sure. Okay. Good. So see you next week. Group apa first?
15 and 16, Doctor.
15 and 16. Okay. So as I think I finished my briefing. Okay. So assalamualaikum. Okay. Bye.
Thank you, Doctor.
Okay,
Doctor.
welcome.
Thank you, Doctor.
Hi, good morning. You had your test yesterday. So how was it?
It was postponed tonight, Doctor.
Postponed to tonight, ah?
Yes.
Why, what happened?
Um,
You requested.
no. Dr. Rosa got things yesterday.
Okay. All right. So good luck for your test tonight. Yeah, just to go through surgery rotation very quickly. A lot of similarity between the rules and how we do things with internal medicine. I think Dr. Malaika will talk, will brief about internal medicine, but whatever rules, whatever things that she say do apply for surgery as well. So I'm not going to go through in depth or in detail, but you can find this synopsis with all the rules and what you should do, what you cannot do in this synopsis, which I've already uploaded into Putra Blast. So my advice for you is that you have so many units, and every units they have different rules and you do different things, different expectations. Before you go for every rotation, like for surgery, before coming in for surgery rotation, please go through quickly this synopsis and how you are being evaluated, because you are being evaluated. I'm sure you want to score well as well. So in order to score well, look at how you are being evaluated in the rubrics, which I've also uploaded into Putra Blast. So besides working hard, you need to work smart. Okay, this one mostly because this is your first rotation into small animal in UVH. So we don't expect you to be like a DBM5, but it's a chance for you to familiarize with the practices in small animal surgery. And here is when you develop your skill, how to restrain animal for different procedures. And of course, to take care of the animals, to look at how we work, and also to help out. My advice for you is that teamwork is really important between yourself and also between you and all of us in the surgery team. So it's not like the students work on their own and the staff work on their own. You have to work together, help each other out, always be observant and be helpful. Don't be afraid to ask questions and don't be afraid to offer to help. If you see somebody is doing something, you can always just offer that, how can I help you? Can I help you? Do you need any help? And things like that. And then this is how you learn. If you remain quiet, just sitting at the side, just observing, the things that you will learn will be much lesser than people who are more proactive. And you are there to learn, not just to follow instructions. And so always ask questions like, why are we doing this? Why we have to do this way, but not the other way? And we are all doing this for the sake of the patient. Of course, from what you hear from a senior, they might think that small animal surgery or intermedicine rotation is really stressful, but we are doing all this for the patient, and every one of us is anxious and would like our patient to recover as soon as possible. So we are part of the team, so let's do this together. And any mistakes that you have done, it reflects the reputation of the vet and also UVH. So we are more strict about what you're being done. So initially, this is your first semester, we will not let go everything for you to do on your own. Every time you do something, ask for permission and ask for supervision. So on Friday, the next group who is going in next week, I think maybe 7 and 8. So this Friday, which means tomorrow at 3 p.m., you have to go to UVH, look for the surgery AVO, and you will be assigned to cases. You will follow a senior and you will attend to the cases together with your senior. Your seniors are supposed to guide you and you are supposed to work together to attend to the patients assigned to you. But that doesn't mean that you don't have to care about other people's case. In order to learn, you have to be a bit busybody and go to your friends' place, and when you're done with your case, ask them what's your case about and what's being done, what diagnosis is being done, what's the plan, and things like that. So try to discuss the cases with the seniors, with the VO, and your other friends. So this is what you have to do. First, go to get your cases and you will be briefed by the assistant veterinary officer about the rules and the do's and don'ts in the surgery ward. After that, please go to the main OT, the main surgery room, not the student surgery room, main surgery room. Look for Mr. Adam or Haizat. They will brief you about the main OT, and you will be given time to familiarize with the layout of the main OT. So for example, you have to be assistant surgeon. You probably want to find out where do we put the kits, where do we put the glove, the brush, where do we put the instruments, where to look for sutures. Because during OT, we will ask students who are around to get things from us. If you're not familiar, then you will be lost and you don't know what to do. And every time we need to wait for the staff to help us. So try to familiarize and ask the staff what are the common things that we use, where are they located, and try to remember so you will be of great help for us when you come for your rotation on Thursday. And yeah, please just forget about the Putra Blast quiz or assignment before going in for your rotation. I've already removed that. So I expect you to familiarize yourself with the OT and you will do a good job on that. So I don't have to test you. So on your rotation will start on Sunday, where you get the cases from the previous group. So once you get your cases, please always do a physical examination, get good summary and information from the person who's taking care before, and also go through the file. So by Monday, you'll be alone, like that is your case. You have to know your case well, and you're going to with the new DVM5 who take over the case. So every day is the same for you from Monday to every day you have to work night duty from 7 p.m. Some actually will, some VOs or maybe your senior will start coming at 6:30 instead of 7 p.m. Always communicate with your seniors what time they are coming. So liaise with them and come at the same time to attend to your cases. I'm not going to go through all this, so please read on your own. Surgery round on Friday, so remember to attend. Otherwise, you only need to come in the morning on weekends. But otherwise, every day, 7 p.m. or 6:30, you have to be there for night duty. And every week, we have different academician on duty. So if you have any questions or anything, please look for the academician on duty for that week. So after your rotation for that 1 week, you actually have to submit a case logbook, and some academician on duty would want you to present your cases using PowerPoint. So please find out from the academician, like next week is Dr. Lisa. You would like to ask her, okay, when should I submit case logbook? Or do you want us to submit case logbook? Or do you want us to present a presentation and submit a slide to you? Find out from the academician on duty, and always inform the academician on duty maybe a few days ahead before you start your rota, maybe on Friday or Thursday before you start your rota, that I'm from group this, I'm the representative. So we are going to have our rotation next week under you. And do you have any advice, or do you have anything for us? When do you want to have a discussion with us? The time, the location. Find out on your own. If you don't do that, the academician on duty, they might forget, and then you will not get to have any discussion. Okay, ask when you're in doubt. So you probably, some of you might want to start looking for some interesting cases for clinical conference. But for the supervisor of clinical conference, please look back for the surgeon of the case if they are academician. If they are not academician, please look for the clinician on duty to be the supervisor. The priority is always given to the student who is attending the case. And I think for now, the priority is given to DVM5 rather than DVM4. Please be neat, be tidy, have all the things that you need in the lab coat of your pocket. 100% attendance is required, but if you, because of COVID nowadays, if you don't feel well, you feel like you're probably having some flu and fever, it's okay for you to not to come. Just discuss with the academician on duty that you're not feeling well. It's better for you to go to PK and get MC, and ask the academician on duty if you need to replace and when do you have to replace that. Please arrange. So this is how you're being evaluated. Attitude is really important. Okay, so teamwork, and then how you treat others, with whether you are being proactive or not, you respect each other or not, is really important. Clinical and surgery skill, you might get the chance to become assistant surgeon. So every time before coming on Thursday, get to know what surgery will be done on Thursday, so you can read up on that. All right, you are also being evaluated for how many signature you get for your purple book, your CPP book. So please try to get as many signature as possible. This is to encourage you to get as many signatures as possible, rather than waiting until next semester or the when you reach DVM5, you have to rush to finish up the signature. This one, I think Dr. Malaika will go through this with you later. And one thing that I wish that I will not see this when you come to UVH for your rotation is to leave your three-way stopcock open. You detach this from your patient and you push your patient to radiology or to wherever other place with this being open. I'm sure if this IV line is being attached to you and knowing how dirty is the environment full of dust, bacteria, and all the spores of the fungus, you don't want this IV line that's exposed to dirty environment to be attached to your IV line. Okay, so please close one side with a needle and another one with a syringe. Some people take this cap from, I don't know, wherever, some container which is so dirty, which has been there for I don't know how many years, and they think that it's very clean and they kept it back. That's a no. Take a syringe and a needle, replace this with a syringe and a needle, and you don't have to throw away the syringe and the needle at the end of the day. Right after that, you can reuse this syringe and needle at least for one day whenever you want to flush the IV line of that particular patient. Please don't take the syringe and needle that you use on the other patient and use it for another patient. Okay, this one is very critical. A lot of people do these mistakes, and I've already informed the whole class about this, so I don't expect to see this in the ward anymore. You might see some assistant doing this, but you are a vet student, you're going to be a vet, you know what is aseptic technique better. I expect you to do better. Okay, don't tell me that somebody is doing that, the staff is doing that. I already informed you that this is wrong, so don't do that. Okay, and this is how you're being evaluated. So go through this before coming for your rotation. I have also uploaded into Putra Blast the case logbook format. You can make use of this. Just remove the content and type in for your case, how many cases you have taken care of. So you just upload them. Don't have to write from A to Z. Please summarize. This is just an example for you. Not everything here is correct. So you don't have to write in the remarks of progression like, oh, that VO actually talked to the owner and owner agree for this and that. Those are not important. Okay, so write relevant information, and you don't have to write like day 1, blah, 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 day 2 PE finding, day 3 PE finding, only important, relevant ones. All right, so that's all for surgery rotation, and listen attentively to what Dr. Malaika has to say at the end, because you don't want to fail the rotation. And giving drugs wrongly, whether you give the wrong volume or wrong route, is strictly, I don't know how to say it. You might end up having to repeat your rotation or even fail your rotation if you did not check your treatment plan form or did not read properly. And if you change the treatment without any prior instruction or discussion, you will end up failing or having to repeat your rotation as well. So please be attentive of what you are doing. Always double check, be extra careful, because this has happened before and patients actually went downhill and owner was very upset about all this. So please, we help each other. So we work as a team. So please, other than that, just learn as much as possible. All right. If you have any question, you can always email the academician on duty. I will be the coordinator for surgery rotation, but otherwise anything related to your week, like if you cannot come on your week and things like that, please refer to the academician on duty. Not everyone likes WhatsApp, so please email. If it's urgent, or if after a few days you don't get any reply, then maybe you can try to email again or switch to WhatsApp or even calling the academician on duty. But before that, just send an email first. All right, so that's all. Okay, so I'll end here if you do not have any question.
Hello, Assalamualaikum. Can someone respond to me?
Waalaikumsalam,
Waalaikumsalam,
Prof.
Prof.
Okay,
Hello, Prof.
you have to bear with me. I have some problem to share my document. Okay, just wait.
Alright. Hello, Prof. Siti. Nak minta tolong saya share screen ke? Ni.
Hi, class. So Prof. Suri will be trying, she's switching her device into, I think a computer. I can't remember. She's switching devices and actually like trying out and see if she can actually like get something to work. So it looks like there's only 100 of you. So that means there should be people who missing this briefing lah.
Doctor, some of us I think are sharing same devices since they're already in the college. And
Okay,
most
I
of us
see.
not. Yeah. Later
Okay.
I'll check back with them.
Never mind. So just make sure that actually like whatever, like if anybody had missed, please find out from friends, from the group mates, go through Putra Blast, go through. So I might as well give announcement. You will be having a quiz this week. So since actually right now it's free, I just ask you. Uh, so I learned that now you have your test one, your surgery test tonight. Any other test you're having tomorrow or Saturday or Sunday? So when do you want to have the quiz? The
Uh,
class can decide now.
what do you think, class? Because this week only one test only, surgery, and next week also
Next week?
got
Next
one
week got
test.
test
Theory, one paper, one course.
on Tuesday.
On yeah, I check back.
Okay. So, okay, whatever it is lah. So for sure, then it would have to be later you can decide lah whether like you want to have your quiz tomorrow or have more time for you to go through and so on. Then it could be Saturday also can. But I need to have actually a same time. So I already announced here, and then I wouldn't. It's just one chance only. So open that session, everybody get into the Putra Blast and actually like do it. So you give me the agreed time that works for you. No excuse saying that you have low bandwidth. So you want to make arrangement to make sure that for sure you will have no problem accessing into Putra Blast at the agreed time. So the quiz, it will be not more than 1 hour. Usually it's just like a couple minutes, you probably will finish. Okay. I think Prof. Suri already entered.
Can you hear me?
Okay, I can hear you, Prof. Please go ahead.
What about the student? Can the student hear me?
Yes,
Can.
Prof.
Yes, Prof.
Yeah. Okay. Now I'm going to look for the file that I'm going to share with you. One moment, yeah. Okay, can you see the file?
Can,
Yes.
Yes,
Okay.
Prof.
I try to start with this one first. Then I go start the other one. Okay. Okay. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much for your patience. I'm Siti Suri Arsyad. I'm the coordinator for the Virology lab. Okay. And in my lab, there are 4 virologists, including myself, and there will be 3 staff, okay, that will be handling this course with you for the whole semester. Okay, our team is not that complicated like other thing this morning. We are not many people, so I don't have to show you the the picture because I think you have met her before. Okay, so I start with this first regarding I think you may want to pay attention here because different lab, different unit has different arrangement. So you may want to pay attention. For virology it will be different, for other lab will be different. And however, for the lab regulation, dress code, attitude, that is very much expected from you from virology as well. Okay, so I'm going to only focus what is very important here. Okay, in virology lab, because our lab is actually, virology lab is actually part of the VLSU, so it's actually not only for teaching, but as well serve for research as well as diagnostic services. So when you enter to our lab, you must sign a form known as form on confidentiality and impartiality. Okay, so if the lab staff or any of the virology in charge forgot about this, you have to remind us. You have to sign that form to declare that you're not going to release any information. It happened that you see in our lab or you happen hear what happened in the lab. Okay, because in our lab we also talking sometimes a very sensitive issue on the COVID-19 testing results. Okay, so this one you cannot share, you cannot talk outside from the lab. Okay, so that's very important. You have to sign the form, and this form also will be with other document we will share with you in the Putra Blast. Okay, by the way, if you have any question, you can always put in the chat box. If you want to ask me, I can discuss later. Okay, generally in Viral Lab, okay, so it's very general. I just straight away go to the introduction. Okay, because of the COVID, the pandemic, we have to require complete re-evaluation of processes and procedure. So this is to ensure the maximizing health and welfare of all personnel working, including the student, okay, coming to our lab. And also we want to continue function of teaching, research and diagnostic laboratory. It's very important for you to comply with the My Sejahtera, okay, because if any of us turn out to be positive, we have to close the lab. Okay, there's no research, there's no teaching at all. So you have to very closely follow the instruction. Okay, procedure in the lab, like any other station, you have to ensure that you have to fit and healthy. There's no symptom from you. If you have symptoms, you have to stay in your college or at home. And then you have to ensure you have to have a PPE, a clean PPE. Okay, face mask is compulsory. Okay, and then this is a norm now. You have to declare that you are low risk, no symptom in Sejahtera. We have the code in the entrance toward the BLSU entry, and then you also have to do this COVID-19 risk assessment, self-assessment for the UPM purposes. And then there is a hand sanitizer. You have to use them upon entry and upon exit of the lab. And then you have to fill in the student daily attendance logbook and sign in the attendance. This is in addition to the one you're going to do online, okay? And you have to don your PPE, okay, the white coat, covered shoes, glove, okay, this is very important. Physical distancing, we need to make sure that there will be no crowding. I know there will be 2 group will be coming to the lab, but we have to make sure that you have to standing, okay, at least 1 meter among yourself, okay? Not too close, okay? And then after you've done your work, you have to inspect your workplace. We will provide you 70% alcohol, and then you have to dispose your PPE properly, wash your hands thoroughly, okay? And then in case there is emergency happening, for example, there is a case of fire, chemical spillage, biological spillage, minor cut, all these things you have to immediately inform us and the staff, okay? We have to take immediate action, and based on the emergency, the appropriate response will be taken, okay? So you have to observe all these things, and we have all these kit available in the lab should this anything happen, okay? If you have any question on this one, okay, please put in the chat box, or else you want to read this letter. This document has been uploaded in the Putra Blast under the section of virology. You can always check, okay? Okay, can I move to the next section?
Can, Prof?
Yes, Prof.
Okay,
No
thank
problem.
you. Can you see the document now? Hello, can you see the document?
Not yet. Just gray screen.
Tell me if you can see, right?
All right, now can.
Okay. So this is the schedule in the Waroji lab. Okay. Um, okay. Can you see the whole timetable?
Yes, Prof.
Okay. This for Waroji session, there will be session A and session B here. Okay, meaning that our lab practice lab Waroji will start at 2 o'clock. Okay, 2 o'clock to 3:30, about 1.5 hours. All the assigned student will come to the lab. Okay, one group will be in the Waroji 1. The second group will be in the Waroji 3. Okay, make sure you know where is Waroji 1, Waroji 3. It was being the label is appear on the door of the entrance. Okay, so in Waroji lab you will meet Encik Azman or Puan Ayuni, and in Waroji 3 where you meet Encik Rosdam. So these are the technique that we're going to do. So what happens is that, for example, you are in Waroji lab 1, you'll be spending about 45 minutes, okay, under the supervision of Cik Azman, Cik Ayuni, to do virus inoculation, okay. After 45 minutes, you will move, okay, you will go to the Waroji lab 3 to work on the tissue processing and vice versa, okay. And then after you done this, you can now exit from the lab, and we will start with the second session that is on the presentation on topics in virology. This will be conducted online, and it will be handled by virology on duty. It depends who is available on that day for your assigned for your group. Okay, this will last for 1.5 hours. Okay, I will. Okay, the online system will be on at 3:30, but because you are moving out from the lab and you are going to enter to the system. Okay, so the discussion only start at about 3:45. We give you about 50 minutes to move around. Okay, to move to check out from the lab. Maybe you want to go to the college or you want to study in the student room. So we give you about 15 minutes to move around, and the discussion on the topic will be started by 3:45. Okay. So make sure you sign in. Okay. Please here when you come to the lab at 2 o'clock, you must sign in to the Putra Blast. Okay. And then when you sign in into the discussion at 3:30, make sure you log in using your full name and metric number so that we can capture your attendance. Okay. And then assessment. This is a very generic assessment from the coordinator. So basically, there will be a pop quiz. This is a continuous assessment, will be performed by the PK, Dr. Chen. Okay, meaning that you may receive a question of virology based on the paraclinical round on that week. Okay, so that when there is a virology case presented, you might receive a question from us. Okay, that will be handled by Dr. Chen. And the second one is a final quiz. This is also handled by Dr. Chen. And in the lab, it will be on the based on rotation. Okay, like any other rotation, you will be assessed using the rubric, a set of rubric that I will share later on in the Putra Blast, that you can see what is the expected things that we expected from you. But basically, it will be very much similar with other lab. Okay, and of course, we are very much similar with other pathology lab. For example, with the bacteriology and also with parasitology. Okay. Okay, this is your club representative. Okay, Zulkifli would have all our contact numbers. I have shared with him. So if you need to contact me or other virologists on duty, you can always ask from him. Okay, so he has everything. Okay, can you see now the second table?
Yes, Prof.
Okay.
Yeah.
This second table is on the timetable and virologists on duty. So you can see here your group number. Basically, we're going to start our rotation next week. Group 17 and Group 18. Of course, Group 17 will go to Virology Lab 1 and Group 18 will go to Virology Lab 3. And then after 45 minutes, you will exchange the lab. Okay. And then for the fifth, sixth, and seventh week will be handled by Dr. Yasmin. So group leader, group representative, please contact Dr. Yasmin 1 week before, okay, so that she can share with you the online discussion link, okay. And then we have a break, and then after coming from break, week 8, 9, and 10 will be handled by Dr. Nofitria, okay. And then week 11 to week 12, okay, will be handled by Dr. Azmi. And then finally, week 13 and week 14 handled by myself, okay. So this is some notes for not only for the student but only for VOD, just to remind us that there will be about 5 to 6 students, 12 maximum in the group. Then in the lab, later on, I think you were going to work on cases that we assign to you by pairing. So make sure if you happen to do a tissue processing, 2%, make sure the 2% will have 1 meter distance at least. Okay, so not too close. And then see here that I have mentioned just now, group representative must contact VOD in charge 1 week before to receive a link, and the cluster has the contact number. And please make sure that you sign in the Putra Blast started at 2. If you have any problem with key in your attender, you can contact Dr. Nofitria because she handle the attendance, or you can contact me. So we can be contacted by WhatsApp. Okay, so no problem. WhatsApp is much more faster than email. Okay, and then you can log in into discussion platform at 3:30. It depend on the VOD in charge. Some of us like to use Webex, some go using Zoom, some using Google Meet. So is you have to be alert on this. Okay, and our discussion start at 3:45. Okay, and then this is the one activity that I mentioned just now here. Okay, this activity here. Okay, so the section B, presentation on topic in virology. This is just example because the updated list you have to get retrieve it from the Putra Blast. Okay, so instruction, student will retrieve the topic 1 week earlier in Putra Blast so that to give you time to prepare, okay, and search for the information. Student must search for information, definition of all the listed topic either individually, or you can work in the group, or you can group in pairing, doesn't matter, as long as that you have to work with all the topic that we have given to you. Individual student will present topic assigned to VOD at random. Okay, and then in the presentation, when you are preparing the title, you must provide at least one example. For example, one disease, one condition, one scenario, or for example, if you can see here the title number 1 here, confirmation test, maybe you want to say the confirmation test is RT-PCR. Then you have to justify why RT-PCR, because it's using the specific primer. Or maybe you want to say that the confirmation test you are discussing is immunofluorescent test, and then you have to give example why, because immunofluorescent test using a specific antibodies to the disease or specific monoclonal antibody to the disease. Okay, things like that. Okay. And then, of course, during the presentation, like any other courses, we will evaluate you using a rubric, okay, to assess your knowledge, okay, your lab skill before, and also your leadership here. This include your communication, your punctuality, your attitude, and many more, okay. So these are example, okay, of key learning issues that we need. But this is not only 23, there are more, okay. But this is a example, okay. So meaning that if you receive this list key learning issues, you have to work all the titles, okay. And of course, all these title has been you have learned this one, okay, you have come across this one or you heard this one before, either in our course VPM 3340 or even during our recent VPK 3935 clinical rotation recently. We have many times using this word discuss. We have go sometimes very detailed about this one, okay. Okay, the last part that I want to mention here is in the Putra Blast. Okay, I have uploaded this instruction if you want to refer them again. Okay, the instruction to student, and also I have uploaded a practical hands-out. Okay, for your lab work here, we're going to focus on only 3 techniques here. The first, these are the techniques that you have not able to do before because of the PKP. Okay, so we will focus on tissue processing. You will give infected tissues, you will process, and finally you will get the supernatant, and then at this session you will include the supernatant into the cell culture. And then of course, because cell culture or egg inoculation take about 5 days to observe, so we already prepared for you a positive control for you to see what is expected if the virus is multiplying in the cell culture. We'll give you example, okay. And then you can also download the techniques, okay, the method in the Putra Blast. And then the SOP just now also have been uploaded for you to go through again. What is required in the Putra Blast, there'll be attendance for the practical that we expected you to key in by 2 o'clock. And then the key linear issues also be uploaded for you to do your homework, find out more information. And then there also be a form for confidentiality and impartiality in which every single of you have to fill in and sign, okay, to agree with our term and condition. And of course, finally, the rubric for the assessment for you to know what will be expected from you. Okay, I think that's all from me. Um, if there is any question. No, Hakim say okay. There's thumbs up there. Okay. So if there is, if you have got any problem after that, on you can always ask Hakim to text me. Okay. But if you have a very specific issues you want to discuss with your VOD, you can always communicate with them. Okay. But no problem. If you're not able to get there, you can always come back to me. And also, just this is also to mention, mainly the problem we arise is when you're not able to key in, uh, or you're not able to be present physically in the lab. Okay. And when you have emergency, you are sick leave, you have to let us know. Okay. Because if you don't attend this exercise, there will be no marks for you. Okay. And of course, we when there's no mark, we cannot sign any logbook for you lah, regarding this technique that you have that you are supposed to be in the lab. Okay. So I see there's no question. That's it from me. Okay. Thank you very much for your attention. So we'll see you next week in the Virology lab. Okay. Bye-bye.
Prof.
Okay. Thank you.
Thank you, Prof.
Thank you, Prof.
Okay. Thank you. So I may leave now.
Prof, you can leave. Dr. Maslina, are you here? Dr. Maslina? Rasanya tak ada. Dr. Maslina, good morning.
Good morning. Sorry, I have AGM at the moment, so I can.
Oh, no worries. But since you're here already, okay, the floor is yours.
All right. Thank you, Donna.
Thank you.
Okay. Assalamualaikum and very good morning, everyone. So I'm the head for the pathology section. So the briefing today, just to inform all of you that for the pathology section, you know that we have para-clinical rounds every Thursday from 8 to 9 a.m. So you're supposed to come for the para-clinical rounds. And then on, you are supposed to have your rotation from 9 a.m. until 12 noon. So what we expect you to do is that first, you should be able to conduct proper postmortem. And then you should be able to describe gross lesions seen during the postmortem and provide the morphological diagnosis. Then you should be able to perform proper sampling techniques at postmortem, describe the proper fixation of tissues for histopathology, describe the histological slide preparation. This is optional. I think most of you have exposure during your latihan industry, so you should be able to. You must have some knowledge about this already. Then you are supposed to be able to interpret histopathological slide. This is in cases where we don't have any carcasses to do postmortem, so perhaps most of the pathologists will provide you with histopathological slides. Okay. Then from all of that, you're supposed to suggest the possible diagnosis, explain the pathogenesis involved, leading to the death of the animal, and last but not least, write a proper report. So just to brief you, who are the staffs in the post-mortem unit. First, we have 5 pathologists who will be on duty. Okay, Associate Professor Dr. Mat Sabri Muhammad Yusof. We also have Associate Professor Dr. Ana Saleh, myself. Then we have 2 new pathologists, Dr. Nurul Izzati Udazali and Dr. Kok Meng Kiang. Our veterinary officer is Dr. Muhammad Ali Zakaria. We have 3 support staff in the post-mortem lab, Mr. Ghazali, Mr. Najib and Mr. Aizat. And in the histopathology lab, we have 2 support staff, Puan Latifa and Puan Zainatul Aisyah. So for post-mortem section, you must have your own coverall and your lab coat. You must wear your coveralls when you handle large animals, but you can wear your lab coats when you handle small animals. Another thing you must have is the gumboots, and for the gloves and masks we can provide, so no worries on that. Okay, what you're supposed to do, we expect you to come to the post-mortem lab punctually at 9 a.m. You need to report to either Mr. Ghazali or Mr. Najib or Dr. Alif to sign your attendance. And then you must know who is the pathologist on duty. This you can check on the Putra Blast. Usually I will upload the duty roster of pathologists on the Putra Blast. If not, you can also refer to the schedule posted on the whiteboard at the postmortem lab. Next, you have to check whether there are carcasses submitted for postmortem. Okay, this usually you can see at the registration table. Then if you have the case for that particular day, you're supposed to perform the postmortem with the pathologist on duty. After performing the postmortem, you need to fill up the borang laporan pelajar makmal postmortem. This will be provided by the staff. Discuss the case handled and hand over the form to the vet officer. In the end, you need to submit also a copy of your report to me by email at the stated email, latest by following Monday. Okay, so this is actually the form that you're supposed to fill out after you have conducted the postmortem. But in instances where there are no cases submitted for that particular day, we do prepare, I think, surgical exercise dogs, which you can practice to do your postmortem. Okay. And if not, maybe we do have any spent hands provided by maybe Dr. Nick or Prof. Jalila. Okay. But again, if there are no exercise dogs, I mean surgical exercise dogs or even spent hands, then only the pathologist will assign cases to you. Maybe the pathologist will provide histopathological slides or maybe images for you to do your, I mean, to have your discussion and later on write your report. Okay. So basically, if that's the case, you need to identify the tissue or organ, describe the changes that you see under the microscope. Okay. And from there, you need to suggest possible diagnosis and discuss the whole the case with the pathologist on duty. So for the assessment, as you know, the total assessment comprises about 80%, which 40% comes from PO1 component, 30% comes from your psychomotor or your hands-on skill, and another 10% is for leadership qualities. Okay. And this is just to wait, okay, just to, I'm sure you have been to the postmortem lab. So just a recap, the registration table is here. So you can find if, let's say, whether there is case available or submitted on that particular day, you need to check here at the registration table. To check for the duty roster, you need to, usually the staff will write the pathologist's name on the whiteboard. Okay, so the staff will be in the staff room. Dr. Ali will be in his room here, vet officer room, and the histopathology lab is at the bottom in the image. Okay, so you're supposed to come using the appropriate entry or route, and then again, whenever you want to exit the postmortem lab, make sure you dip your gum boots in the foot dip. Okay. Last but not least, because we're still having the COVID-19 pandemic, so please practice the SOP measures. Okay. Other than that, I think that's all from me. Any question?
No, doctor.
Okay,
Not
so
really.
basically you guys need to bring all your knowledge, everything you have learned from your first year up until now. Prepare yourself because at postmortem you need to have all the basic knowledge lah. I mean all your anatomy, histology, physiology, your animal diseases. Okay, so prepare. I mean, yeah, come prepared lah. Alright. Okay.
Yeah, doctor.
Okay, if there's no further question, I pass back to Dr. Chen.
Okay, thank you, Lina.
Thank you.
Back to your AGM then.
Yeah, thanks.
Okay, bye.
Bye.
Okay, let's just see if Dr. Azalia is here. Dr. Azalia. Ada ke? Okay, it looks like so Dr. Azalia probably will come in time because she says she only 15 minutes and according to schedule supposed to come in at 11. So if you want to go offline, go ahead. So and then be back here 5 minutes before 11. It will be using the same this same ID. So if you want to go off and have a break and then come back in 15 minutes time, that will be great. All right, thank you.